Hello again, I'm David Holden, creator and MC of the Holistic Cancer Congresses. And I'm here discussing with Liz Hart, who's one of the presenters at the Congress in March 2013. I wanted to introduce her to the audience and she can share a bit about how EFT works and what it does for helping outcomes with patients with cancer. So Liz, you're fairly well known in the EFT community in New Zealand. Can you share with the audience a bit about your background and how you got into this area, please?
Sure. So my early background was in education and psychology and metaphysics at university. And I worked in counselling early on, worked with a lot of children who were in abuse situations. Following a period of raising my children, I went into working and trying different natural health therapies. I worked with Neuralink for a while, which is a fantastic system. But what I noticed is it didn't deal with the emotional issues that were stopping some of my clients getting well. And when I found out about EFT, I noticed that it made a big shift for some of these clients. And people who had been stuck in a health condition for a long time suddenly started being able to progress towards health again. And for me, that was a fantastic thing.
Great, good. So can you explain a bit about what EFT is for the audience in a nutshell?
Sure. EFT stands for Emotional Freedom Technique, and it's a series of strategies for reducing emotional intensity. So what it is like emotional acupuncture, except you don't use needles, you use tapping on the energy points as well.
That's a good analogy.
For some people a lot more comfortable. It's something that you can do for yourself as well as something that you can do with a therapist. And one of the things I really like about it is that people can then really take control of their own health and their own well-being through this technique.
Great, excellent. So can you share with the audience how you use EFT with a cancer patient or cancer patient's family or friends or support people?
Absolutely. So EFT helps with cancer clients by enabling them to overcome the initial shock and trauma of the diagnosis, and then to make the changes in their lifestyle, diet and so on and so forth that are required for them to recover their health. It can help them with pain management, and it can also help their family and friends adjust to the changes that are going on for them. For some clients who are not going to recover, it can help them through the dying process and help their family through the grieving process.
That's really important.
Yeah. The other thing it can be really helpful for the medical staff who are looking after the cancer patients, because of course it's a very stressful situation for them too.
And hospice staff particularly.
Absolutely, and they really want to do the best they can for their patients.
Sure.
And it's very intensive. So for them to be able to look after themselves, EFT is a fantastic technique.
Great. So Liz, with your background in counselling, what was it that drew you to EFT as a particular tool? Because I know you're using that, not exclusively, but it's a big part of what you do with patients. So what was it that drew you to EFT of all modalities that are out there?
So there were two things that were really important for me in deciding to use EFT as my major modality. The first was when I first came across EFT, it was in the context of it being used within the prison and probation service, with men who were on parole and with their parole officers. And what they were finding was that these chaps were not going back into prison, they were sorting out their lives, they were getting jobs, they were sorting out their family lives.
Right.
And I previously worked in a prison helping teach meditation. And I knew how difficult it was to work with these guys and to get them to engage in these programs.
Right.
And they were being very successful.
Brilliant.
So that was the thing that convinced me in the early days to investigate it. My personal experience with it was that I had a back injury, and I was told that I need double spinal fusion in order to repair the injury, and that because of a condition that I had, it would mean further surgeries over the years to continue to basically lock up my spine. And I wasn't excited about the option.
Understandably. Yeah.
And so I began using EFT to manage the pain of the situation while I was awaiting surgery, and also investigating why I might have had this problem in the first place.
Okay.
And one day I came across a thought that popped into my head about a grief issue. And so I began tapping through this grief issue, and within 24 hours I could walk again comfortably.
Wow. That's
and
amazing.
I was completely shocked.
Yeah, I bet.
But it gave me the real reassurance that these major shifts and changes that we hear about online and in different newsletters and things actually can happen.
Yes.
Because they happen to me.
Yeah.
And so I felt a lot more confident working with others.
Right.
You know, they're not all 2-minute wonders, and you'll hear about these online.
For sure.
Occasionally they happen. But with hard work, you can actually make these transformations happen.
Right. And I know my experience for the audience with EFT has been quite profound as well. And I've noticed with patients I've referred to Liz for various conditions, not just cancer, have had massive turnarounds in their emotional well-being, their sense of isolation and being able to diffuse that and be able to reach out and ask for help, depression, massive changes with depression without medication, which is fantastic. Doesn't happen in every case, but certainly in the mild and moderate cases it can happen. So I'm very keen to see EFT being used a lot more. So Liz, can you share with the audience specifically what you're going to be talking about at the event in March 2013 in Auckland here, and a little bit about what you're going to be presenting?
Sure. So what I'll be doing initially is I'll present a little bit about the research behind EFT, so you can see how it's come about, and a little bit about the story of how EFT came about. And then I'll be talking about the different ways that cancer patients, the medical staff, their families and friends can all work together to support the patients as they're going through whatever treatments it is that they've chosen to do.
Great. Well, I'm really looking forward to hearing Liz's talk, as I'm sure many of you are. So please do come along. If you haven't yet registered, time is running out. Tickets are selling fast. Please book online on this website. And if you've only just heard about EFT for the first time, there's a lot of information that we'll be sharing post-Congress on how you can find out more about EFT and EFT training courses. And yeah, we look forward to having your presence. I think you can understand that this approach is very helpful in palliative care particularly, but also very good for family support, for the spouses and partners of cancer patients, as well as the cancer patients themselves. So as part of the holistic concepts behind cancer, we're not just treating the person, but their spouse, their immediate family, and even their extended family if they're involved, or the whānau if they're involved with that person's healing. So thank you very much. Look forward to seeing you at the Congress. We've got some great things lined up for you. Stay tuned.